So yesterday I was diagnosed with prostate cancer. My father died of prostate cancer just over a year ago, and ever since his diagnosis I've been having regular checkups. So I'm still fiddling, oh there we are, that's how you do it. I've been having regular checkups, so that's about 4 or 5 years. So when I got the news, I don't know, funny mixture of reactions. Partly just relief they finally found it, because every year my PSA count goes up. And I went through a phase of thinking, well, if they're not finding cancer, shouldn't we be talking about, well, what else might cause a high PSA count? And I just got this kind of pitying look from the consultant, so I thought, oh, okay, maybe that's not it. So partly thinking, okay, right, so it's there now, so now we can move from looking for it to treating it. But obviously this morning, waking up and thinking, oh fuck, I've got prostate cancer. So I don't know, kind of mixed feelings. And I'm kind of getting around telling people now, look at the camera, not in the picture, getting around telling people that I've got the cancer, and people being really lovely, really supportive. The first time I was actually in the same room as someone, it was Juliet, my friend Juliet, took me out for lunch the day after my birthday, so we went down the pub. And it was the first time I actually said the words to somebody, I've got prostate cancer, and I just burst into tears. It was really upsetting. So in a way it's good that I've done that now. And the reality, I think, is sinking in more now, because it just seems so, it's the kind of thing people make films about and write books about, and cancer, it's just got that kind of drama to it. So I don't think it felt quite real, but it's feeling more real now. I think part of the problem I have is, well, what can I do? I'm just helpless. You know, they'll operate on me and I'll get better or I won't get better, and it's completely out of my hands. But I feel now like there is a thing that I can do, and I feel more optimistic. I think I'll have the operation, I'll get clear, I'll become teetotal, and I'll be one of those irritatingly healthy 80-year-olds jogging around the park. So perversely and by a roundabout route, it feels quite positive. I mean, yesterday I read an article about Harold Pinter. I thought, oh, he died of cancer. And on the very next page there was a review of a book by Christopher Hitchens, with a foreword that he's added for the paperback edition, which said, I'm now at stage 4 of esophagus cancer. There is no stage 5. I'm kind of noticing that. And this morning, weirdly, by coincidence, a woman came up to me in Sainsbury's. I'm going to dismiss the message. Came up to me in Sainsbury's and said, are you Andrew? Yeah, well, do you remember Alan Weston? Well, he died of esophagus cancer a few months ago. And then I'm thinking about people that I've known who died. There was Jean, who took early retirement as a teacher, and literally within a year she was dead from breast cancer. There was Bryn, who was another teacher who took early retirement, and he died. I'm just kind of spotting all these connections with these people. I told my friends Jeff and Carol a few days ago about the diagnosis, and after all the normal expressions of sympathy, Jeff said, have you been watching the Big C on television, in which Laura Linney has been diagnosed with, I think, breast cancer? I haven't seen it. which was sort of a slightly odd juxtaposition, but perfectly understandable. I suppose apart from it being personal and remembering that I do know people who've not just had cancer but died of it, but it's this cultural phenomenon that, you know, the people of my generation, that's what's killing us. You know, maybe 100 years ago it would have been consumption or something. That's the current illness. So it feels oddly zeitgeisty to have this thing. So yeah, I'm just feeling a bit quieter, a bit more reflective today. So yeah, so I'm sort of feeling like, rather than it being this big melodramatic thing, oh my god, I've cancer, I don't know, it just feels like an imposition now. I think, oh, there's more interesting things I'd rather be doing than planning my surgery. So, which I guess is more positive. I'm feeling fitter as well. I'm not training, although in my own mind I'm training. I'm walking a lot and running a bit more, so trying to get fit and doing these bloody pelvic floor exercises. So that's where we are. Okay. But we've just had the hottest, driest April ever, I think. There's been earthquakes in Japan and New Zealand. What else? Had a royal wedding. William and Kate, which was nice. It was nice. They seemed like nice people. It was a nice day, and everyone got the day off. So the world is carrying on. Yeah, so it doesn't feel terribly urgent to do this, but I thought, well, I'll just do a quick update. So that's where we are. Hi, it's nearly 8:30 in the morning on Tuesday, the 12th of July, 2011. And tomorrow I go into hospital to have my prostate removed. So it's been 3 months, 4 months, whatever, since I got the news of the diagnosis. So now it's nearly here. I'm obviously nervous. I'm apprehensive about it, but mainly just want to get it over and done with. I did early on think, is this really the best treatment? Can't we use, I don't know, radiotherapy or chemotherapy or whatever? But it is the best treatment. And it was interesting. There was somebody on the radio saying, you know, everyone was looking for a cure for cancer, and this guy was a surgeon, and he said, actually, there is a cure for cancer. It's surgery, and it has a very, very high success rate. It's not a way of managing the condition. It is a cure. So that was quite reassuring. I'm very aware of cancer stories now. I've been doing my pelvic floor exercises. I'm fitter now than I have been probably for about 18 months. I got some decent running shoes. So having wrecked my knees with these crappy old shoes that were literally 25 or 30 years old, I got some decent shoes, and lo and behold, if you go running on decent shoes, you don't knacker your knees. So I do that, and I walk, and I've been doing push-ups and stuff like that, and generally trying to tighten my abdominal muscles so I'm a bit more held in. So I feel in pretty good shape, which is the other weird thing. You know, I'm not going into hospital feeling ill and come out feeling better. I'm going in feeling really good, actually. And I'm going to come out feeling like death. Right, it's now Saturday the 16th of July 2011. So it's 4 days after my operation. I've just come out into the waiting room to do this. It all went well. I'm making good recovery. I'm moving around. I had a scary moment yesterday with a guy. One of the doctors saw that I was, saw that I was on my feet and said, "Oh, we'll send him home tomorrow." And I walked upstairs. I can shuffle, but I can't do anything else. So I was a bit apprehensive, but today he said, well, no, you go home when you're ready. And my surgeon, Mr. Doherty, said, aim for Monday. So I'm going to aim for Monday, and my friend Peter's going to come and pick me up. So, kind of feeling all right in myself, bruised and battered. But yeah, it's gone well. Hi, it's now Sunday the 17th of July 2011. So the operation was Wednesday, so it's been Thursday, Friday, Saturday and Sunday. And I'm dressed. I had my first wash. Can you do that? I had a wash today for the first time. I put my own clothes on. Oh, I'm looking in the wrong place, that's why I keep covering it up. I'd started to feel human. I'm due to go home tomorrow, and it feels like, yeah, I can definitely do that. So today I want to make sure I do all things today that I'm going to have to do when I get home, like washing and dressing. I feel much better. I overdid it yesterday, and this is the thing, it's finding the balance between pushing myself and letting myself rest and recover. I don't know whether I'll include this in the video, because they've cut through all the lymph glands. There's lots of lymph fluid going into where my prostate was, but it's got nowhere to go, and that was me farting, which is a good sign. And it just follows gravity. So they'd said in the leaflets, oh, it might collect around your abdomen, you might get a little bulge there, but don't worry about it. But it didn't. It all collected in the skin around my penis, and it was horrendous. It was like an elephant's trunk. It was just ghastly. So I called the nurse. I said, well, I assume this is normal, but I don't know. Does it need some treatment? And she said, no, that's perfectly all right, but you have been on your feet all day, so you might want to lie down a bit more. So there's weird things like that. They don't tell you that in the brochure. So, so I'm making all sorts of discoveries. But yeah, feeling much better. Feeling definitely positive now that Monday is a reasonable day to go home. Whereas yesterday I was thinking, God, I don't know. I know I ought to do it, but I don't know if I'm going to be ready. But I do think I will be ready. So it's good. It's a good morning. It's a good morning. Hi, it's now Wednesday the 20th of July 2011, and I've been home 2 days, and my prostatectomy was exactly 7 days ago. So that was Wednesday the 18th. It's now Wednesday, whatever. No, sorry, Wednesday the 13th. It's now the 20th. So it's been a really quick recovery so far, so I feel like I'm well on track. So, well, I was in hospital, they said, you're making good progress, and I feel like I am. Not exactly setbacks, stuff that went on the night after the operation, because I've been training, my pulse rate and my blood pressure had got lower as a consequence of that, and the machine kept pinging to say my vital signs were too low, and it looked like I was dying, so people had to come and reset the machine. And then the first day after the op, they sat me up in a chair and I fainted, probably because my blood pressure genuinely was low, and they treat it as a cardiac arrest, and every doctor in the hospital comes running around. But since then, I was then walking up and down the corridors as soon as I could. I then, because I knew I had to do the stairs when I got home, I then practiced walking up and down stairs a couple of times. So on Monday, when my friend Peter brought me home, got up here fine, and it felt really good. It felt really, really good, and it was nice. He had his family with him, they had a dog with him, and just to be not in hospital world where you're surrounded by middle-aged men with various life-threatening conditions, comparing drugs and bowel movements and all this kind of stuff. Just to be caught up with other people, it was just what I needed. Yesterday I gave myself a quieter day. I didn't leave the flat, but was sort of phoning and emailing people and letting everybody know I was here. I felt very good. Today I've been for a walk around the block, so I've been up and down the stairs, went around the block, and then had a nap after that. So it's kind of just
yeah, hard to keep pushing myself. So I think so it's Wednesday. I've got to go back in to have my catheter removed next Monday. So I want to make sure by the weekend I'm at least walking as far as the shops, and even I have to walk in and get a bus back, just keep building my strength up. But yeah, so far really good. Feel positive. Feel healthy. My voice has got a bit tired now. I don't know. I was feeling sounding a bit more normal. So I think maybe I've gone slightly tired today, but I think that's inevitable. Good days and bad days. So yeah, it's good. Good progress. Feeling good. Hi, it's now Monday the 25th of July 2011, and this morning I had my... Oh, somebody walking past. Keep my voice there. This morning I had my catheter removed, and it went really well. So I guess the big stages in the recovery. One was getting home, and that was a bit nerve-wracking, but was great. Many thanks to Peter and his help. And then the next one was today. And obviously, once the catheter comes out, there's a risk. Well, you just have no control whatsoever, and it's all just gushing everywhere. And they said take spare pairs of pants, and I took a spare pair of trousers as well. None of which I needed. So apart from just squeezing out the odd little sort of drop when I first moved, I've got reasonable control. I walked all the way home from the hospital, which is 3 or 4 miles. I planned where I was going to stop and have a wee on the way, but it's really good. It's really good. So that's the last bit of the treatment. I go back in about 6 weeks' time. Sorry, I'm looking down because I've got the cat here. I'm just not quite sure what's going on. I go back in 6 weeks' time for a follow-up consultation with a surgeon, just to make sure it's all okay. And then 6 weeks after that, so it's a total of 3 months after the operation, there's another PSA count. But the nurse I had today said, he said they'd done the histography, which is when they examine everything they took out, which confirmed that the cancer had not spread. It still kind of leaves open the question, well, why was the PSA count so high then? They haven't found anything that says why it was so high. He didn't seem unduly concerned with that, but I guess still at the back of my mind, there's still the thought, well, has it gone somewhere else? And we don't yet know. So that the big test of that will be the next PSA count in 3 months' time. But I feel really good. I feel so much more positive now that that's the treatment. It's done, and I can just get back to getting fit, because I've been walking a lot, walking miles, make sure I've got really good bladder control, because then the next test is getting through a night without weeing, because when you fall asleep it can sometimes be a bit worse, you lose control. So yeah, so far really good. So I'm looking at my picture, I'm not looking at the camera. Hello camera, there you are. A really good success story so far. I feel terribly fortunate with the whole process. The early diagnosis, excellent and early treatment, and then the aftercare today really makes you appreciate the care that's out there. It's good. Hi, it's now the 13th of October 2011. I went in to give a blood sample last week, and I went to see my doctor, Mr. Doherty, today, and he confirmed that the blood test confirmed that I no longer have prostate cancer, which is very good news, and it's quite emotional. You sort of brace yourself for all the difficult stuff, and you just get on with it. But when finally the pressure's taken away, you think, oh my God, thank God for that. So it's good news. So if you're watching this because you've just had a similar diagnosis, I just want to reassure you that it is treatable. The key is early detection and early treatment, but it is curable. So I'll leave the last word to my doctor, Mr. Doherty. Thanks.
My name's Alan Doherty. I'm your urologist, and I've just told you that your PSA is undetectable, which is consistent with the good histology report you had, and I'm delighted to hear you're doing well.